All right, greetings. Welcome back. EHS 370, Environmental Epidemiology and Risk Assessment. A lot's changed even in the last few days and week, even today with shelter-in-place type orders affecting much of the United States, including Kentucky and Ohio. The background you see is not my office in Richmond, Kentucky. Obviously not our classroom there in the new science building. So that's why the background and things are a little bit different, but we're going to make this work. And for going forward, we've got a little extra time in the epidemiology class where we are not having our symposium that would have been this week. We're also not going to be doing presentations in class, and with so many of you all, those presentations would have ended up taking a few days. So we've got time for you guys to submit your presentations in a more Google Doc or online format, and we'll discuss that later in the term. But for now, we've got a few extra days that we'll be able to build in some background information that is very pertinent to epidemiology on current events related to coronavirus. So as we get into kind of the epidemiology of coronavirus and the background of it, like we did at the beginning of the semester, I started off with the Age of AIDS documentary done by Frontline. And there's a clip that I want to pull up right now that I've got here for you to watch. So we will watch this. And it's talking about President Roosevelt used to do these fireside chats during World War II almost every night. And people would tune in from their radios all over the world and all over the United States to listen. Very similar to how Governor Beshear is handling this situation here in Kentucky. And I'll let you listen to Dr. Merv Silverman from the San Francisco Public Health Department back then for his comments.
President Franklin D. Roosevelt did, and that has had fireside chats, trying to dispel the fears about what was a very serious situation. If you don't have any magic bullet, you don't have any vaccine, you don't have any drugs, education is the only thing that you have.
All right, so those were the comments from Dr. Silverman back, in that, I think that documentary may have been made in the mid-2000s regarding the HIV crisis, particularly the beginning parts of it when it started into the 80s and then extended into the 90s. So you all know that. You watched that documentary already. And I'm not the only one that makes these kinds of claims, kind of the rock star right now on the media, who's been a person that's been familiar to people, not just with the HIV epidemic, but a lot of things. It's Dr. Tony Fauci, and Dr. Anthony Fauci's been the head of the National Institutes of Health's National Institute for Allergies and Infectious Diseases since he showed up during the HIV crisis in 1983, I believe is when he arrived. Now the 79-year-old, still physically fit, mentally sharp, Dr. Fauci compares the coronavirus outbreak to the early days of the HIV/AIDS epidemic and pre-pandemic bird flu. And a lot of it because people are concerned and have fear and anxiety, and there's certain concerns about certain populations being at increased risk. And those fears and concerns are totally real today. And some of the words that Dr. Fauci used in that video that you saw in class, which I'll pull up here in a second, are very applicable to the current set of circumstances and explain why the social distancing measures are being so fully pushed on this particular event. So let's watch this clip that you've all already seen once before at the beginning of the semester, talking about those stage 2 individuals and the risk for disease spread from those subclinical patients.
The serological test indicated that the problem was much more extensive than you would have thought.
It became clear that HIV could infect, but doesn't cause problem until some years later. And there is a period where one is symptom-free, but HIV positive and potentially infectious to others.
So we had a skewed appreciation of what this disease was all about, because we thought that you get HIV infected and you were deathly ill and that was it. not fully realizing the vast numbers of people who are incubating this illness for years and years. As we described back in the 80s, it was like an iceberg, and what we were seeing was the tip of the iceberg.
Let's see what the lymph nodes are doing to this.
All right, so you guys have already seen the iceberg image or figure. We've covered it once before in this class where we showed that iceberg image. I can pause this video. Pulling up that iceberg that Dr. Fauci just mentioned regarding the HIV crisis. There were these reportable cases that we saw, and this was the tip of the iceberg, and we had no clue of how big the amount was that we could not see. Now, obviously, we don't have the problem with subclinical infections going on for years or decades like we were worried about during the HIV/AIDS crisis, nor is the case fatality rate the same as it was for HIV/AIDS back in the 80s. So those are some important differences, obviously, but there are still a lot of other valuable similarities and lessons that we could learn from. And we could think of Dr. Curran's statements in the video. Dr. Curran's now the Dean of the School of Public Health at Emory University, and he said in that video that when the first cases were known, there were 250,000 people already infected. That may not have been the case or may not be the case in the United States. Hopefully it's not the case in the United States. We've been a lot quicker at diagnosing disease than we could back then with HIV, but the concept is still the same, and it explains kind of the reasoning on why some of the folks are doing what they're doing, because they're very much aware to how that epidemic, which was harder to spread person to person than what we're dealing with today, could potentially go. So, all right, now getting into kind of the introductory part of the epidemiology of coronaviruses, I'm going to pause or stop this video, and I'm going to make another video that is more slideshow based here, and I will pause this one for now, and I'll pull that other video up here and get it started here in a second. So hang with me, and if you've got any questions or comments, as always, you can email me or call me, text me as needed.